Well, the PERSIST-1 study was a study of pacritinib in patients with myelofibrosis, an oral JAK2 and FLT3 inhibitor that we tested in phase 3 based on ability in phase 2 studies to improve spleen size and symptoms in myelofibrosis patients, but be able to do so without causing anemia or a drop in the platelet count, and indeed in some individuals even increase it. So it was a randomized study that was unique in that it was intermediate and high-risk myelofibrosis, but there was no exclusion criteria based on the degree of thrombocythemia. So it was the first study that really allowed patients to have very severe thrombocythemia and go on to a myelofibrosis study. They were randomized between pacritinib 400 a day versus best alternative therapy. And what we observed is that pacritinib was as safe and efficacious as we had seen from the earlier studies. There was significant improvement in splenomegaly, meeting the primary endpoints in all subgroups, but in particular in those individuals with baseline platelet counts of less than 100,000 and less than 50,000. And this was the first phase 3 which had allowed patients with a platelet count of under 100,000 to enroll in the study. Second, we saw that there was very significant improvement in myelofibrosis-related symptoms, kind of across the board, but again, that group that otherwise had no other options, really low platelet count, they had really significant benefit. And then third, we observed that 25% of patients became red blood cell transfusion independent, which was a very important finding in that these individuals were able to overcome that in the setting of a JAK inhibitor. So overall, we were very pleased with the results. I think it clearly demonstrated that pacritinib will be an important option for patients with myelofibrosis, and a particularly strong option for those who have a very low count or perhaps pre-existing anemia.